to our sanity, the way our moves, the way we work, our productivity. So the impact of daylight, we're learning we need more red light as we approach evening. We need blue light in the morning. The blue light stimulates serotonin, what keeps us alert and awake. The red light stimulates melatonin. So many of our computers, how many of you have a computer with a night mode on it now? Or how about your cell phone? 7 or 8 o'clock at night, it begins to go red. That's the reason why. And so we're learning how to help ourselves be more productive and get the rest we need by helping affect our circadian rhythms with light color. And the nice thing about it, as we move from fluorescent lights to LED lights, those lights through programming can be programmed to give us the color we need at the appropriate times during the day. Lighting and sleep can be just as impairing or affect our performance as being legally impaired from alcohol. That's pretty amazing, isn't it? Just time of day light, and then also with our blood alcohol levels. That's how much lighting can affect our productivity. So why wouldn't that be important to a business owner? Somebody that's got 6,000 people in a building, he's trying to have them as productive and alert as they can be during the day, and make sure they go home and get the right rest at night. Building it into your employee wellness programs, this awareness. And they're easy, like I said. LED lights that come on board today, they're all adjustable. They can be set up and programmed for the time of day for the right color of light you need. Let's look at comfort and productivity. Another thing that we as an ASHRAE, we as an industry, have a lot to do with, right? What is thermal comfort? Again, the way Tim has defined resiliency, we need to spend time working with partners in the industry, and that's what I'm looking forward, that's what I'll talk about. Comfort. As we get satisfaction levels, some of the biggest things that were least satisfactory in 53,000 occupants, over 351 buildings. Air quality, noise, temperature, and sound privacy. You just heard a young lady talk about our ducts and acoustics. It's one of the worst as far as satisfaction in a building. But right next to it is temperature, noise, and air quality. Everything we do. Lots of opportunity to get better and better with every generation, with every iteration of technology. Temperature. I actually heard last week in Chicago at a presentation, an architect had pushed in Boston to set their cooling set points in the building to 84 degrees. They're not paying attention to the research. Productivity versus temperature. And you know, we always say warmer and lower humidity, but we're finding, and intuitively, when we commission buildings and work with large school districts, they seem to, over a couple of years, as we tweak those systems, come to about a 72, 73 degree temperature set point. And it's apparently natural that that's our most productive temperature to operate in. So we need to learn how to provide that temperature efficiently so we use less energy. Good on time?
Yeah, we have like another 5 to 7 minutes.
Okay, good, great. All right. You were pacing, so I didn't, you know. All right, noise. Disturbs patients, you know, U.S. hospitals, decreases oxygen saturation, elevates blood pressure, increases heart rates in newborns, reduces quality of sleep, slows wound healing, and fosters negative perceptions of patient comfort. So noise, that's part of our indoor environmental quality, not necessarily air quality, but IEQ, right? So let's look forward. And maybe I'm going to jump through. This is my home city, but it's a blue zone project, the city, and we determined that in Charleston, if we could just reduce some of these health factors and increase well-being, we could reduce health care costs by $543 million over 20 years. And this is a town of 60,000 people in the town proper, okay? That's a lot of money, right? So 500,000 people in our Tri-County area, and only about 60,000 in that. Blue zone communities, they look at, you know, the health effects, your sleeping, the diet, a lot of farm-to-table restaurants and things like that, the exercise capabilities within the building, the opportunities to exercise, walking, parks, places where you can get fresh air and physical activity. So we're one of the first cities, or the first city on the East Coast to participate. There are 42 communities in the United States. It's funded by, I think, a Rockefeller Foundation grant, and 1,685 different companies participating in it. And where they've done it, they've reduced childhood obesity by 50%. All right. And then here are some of your leading producers and companies that are working to get rid of toxins such as flammable materials, PVCs, bromated flame retardants, formaldehyde, heavy metals. Our medical university is participating in this. So let's talk about rating systems. We mentioned it. Tons of rating systems on board these days. LEED V4 now has a requirement for some health and wellness. Living Building Challenge, if you're not familiar with that one is primarily focused on that red list of chemicals, material selection in buildings. And then two new ones, Fitwell. Fitwell is actually a product of the U.S. Army Corps of Engineers and the U.S. General Services Administration, and they've actually the U.S. Health and Human Services Office owned the trademark to it, but they use a private company to administer it. And it's an overlay just like the new Well Building Standard. Well Building Standard is a for-profit company that a couple of billionaires concerned about health and wellness of their employees started doing research into this and helping fund some research around the country. They created what's called the Well Building Standard. Fitwell and Well Building are overlays. They go in addition to say LEED, green globes, green. I've suggested even to Jeff last week that we look at these two as maybe being overlays to ASHRAE Standard 189. A perfect opportunity for us to work with partners in the industry. Learn from them learn from our 100 years of experience. Now, the Well Building Standard, it says 7 categories of wellness. Again, look at what we're involved in. Air, water, light, comfort, okay? That just increased last month to 10. All right, so the new standard version 2 just came out. So there are 10 new, I guess they had to do better than Harvard and get one more than the 9, right? But there are new there are 10 categories now, so this slide in just 1 month is obsolete, the way the industry's moving. So what can we do? Air quality testing. That's things that a lot of us do every day. Water quality, ventilation testing, retro commissioning. 99% of the buildings are existing, right? We only replace about 1% of the stock. I mean, we think, you know, we don't have opportunities for business. We do. businesses that can be very specialized. Material transparency and specifications of policy. Demanding that our product suppliers give us that information about the materials in their building materials. And then building certifications such as BEQ. Again, another good opportunity to overlay and integrate health and wellness standards into that. So what should we be doing? This is where we'll do Q&A if we've got time. But I've just got some questions. We stood up this year as part of Sheila's theme, a new energy future. We've got a health and wellness multidisciplinary task group. That task group has the GSA, the Corps of Engineers, the Center for Disease Control, Harvard, and many of our technical committees and standards committees involved in it. But what else should we be doing? That MTG, we hope, will begin to coordinate and disseminate and learn some of this information, and then also, hey, we've been doing this way for years and it works. Look at your test data. What guidelines? How about training? Tim mentioned training. How many times you go in a building and the building maintenance staff has overridden the controls, closed the outdoor air dampers, opened up the chill water valve wide open, turned off the reheat, got your relative humidity near 100 dew points, about what they're coming off the coil at in the rooms. And then advocacy. The other big thing is adoption. Adoption of our codes and standards are slow. We've got GGAC. Mr. Dave Underwood sitting right there. If you've got any questions about advocating for a better standard, you can certainly ask him while he's here this weekend. But helping our members learn to advocate for themselves, their companies, their communities, our standards, to adopt newer and better standards that incorporate these best practices. Questions and answers. Let's talk about some of this. One of the other quotes I like to say in this, and I'll just say it a little different. Everybody's success in this room is going to be determined one conversation at a time. Right? Just think about it. In life, in work, in the community. It's our conversations. That's why we are here. That's why the organization exists. None of us exist in a vacuum. None of us invented or created anything from scratch. There was some ideas, some math, something there that we all stand on the shoulders of giants behind us, right? So let's have a conversation, either here in this room or over the weekend. Just grab any of us and let's talk about these things and generate ideas for us and our industry. Thank you.
Dennis, thank you. Just wait a second. Yeah, please. It's been a very interesting speech. Thank you so much. I have one VOC sensor in my house.
Yes.
It gets tricky sometimes.
Yeah.
But indoor air quality is very, very important, and I think this is the future. And learning from each other is, again, I will emphasize this. Let's learn from each other. Ladies and gentlemen, thank you to Dennis. We have a little gift.
Don't be bashful. Let's talk.
For Dennis, yeah, please, you gotta talk. Please, Mr. Mehmet Şanal, on behalf of Turkish exporters. Yes. Thank you so much.
Thank you. Thank you. Very good.
This is a handmade art craft. Thank you.
Thank you so much.
Thank you so much. Okay. Thank you, Dennis. Thank you. Ladies and gentlemen, on your schedules here, there is a coffee break. But since we have coffee and food served like all day, I'm going to skip this coffee break if you don't mind. If anyone particularly needs coffee on their table, I can help them, okay? And is it okay if I skip this coffee break so we can, extend today? A little bit, that's fine. If you guys need anything, just ask me. Now I will continue to with Üntes. Üntes is our gold sponsor, and Mr. Serkan Uzun, Üntes export manager, will make a little speech for us. We will get to know their company. Please welcome to Serkan Uzun. Serkan, we have 5 minutes. Please go on.
Thank you very much. Actually, I'm not young enough to run to the stand like this anymore. Because when people get old, the move becomes slower. But it's not the same for the 50 years experienced company. So it is right exactly the reverse. When people get old and have 50 years experience, then you will recognize it when working